8. Next week's going to see a moment of huge danger for the health service, it seems, and for all of us who use it, with the junior doctors' strike planned in England between Tuesday and Friday, taking place, of course, around Easter, when there is anyway a reduced hospital service. We are being told that hospitals could struggle to provide even basic levels of safety. The NHS Confederation saying patient care rests on a knife edge. There's huge uncertainty, they say, about the level of cover that trusts will be able to secure to fill the key shifts that need to be filled. One hospital leader has told the Confederation they're facing a catastrophic risk. While it officially lasts only for 4 days, that strike action, the fact of Easter being here as well is an added complication because of the fact that more senior doctors tend at this time to be on holiday. The doctors say they're going to go ahead with the strike at the moment, but they also say they would suspend it with any hint of a realistic offer from the government. The strike, they say, could be easily avoided. We'll hear from the BMA, their union, and from the hospital managers in a second. First, though, let's hear from Jane Walker. Her husband Dave has an appointment, or had an appointment booked for this week before it was cancelled.
My husband's been diagnosed with a condition called idiopathic pulmonary fibrosis, and we've been waiting 6 months for an appointment from the NHS, and we had an appointment on the 12th of April to see a consultant, and we were hoping at that appointment that we would find out more information and also get some medication. It can't cure the condition, but it can help to actually slow it down and manage it, and also advice on going forward, what the future holds. So it's a big unknown for us, and we just wanted answers, and that's what we were hoping to get from the appointment.
And in those circumstances, that appointment, that promised appointment, must have meant not just physically for your husband, but also, I guess, mentally for the two of you, a huge amount.
Absolutely. It's been, what I would say, burnt into our psyche for a few months now. It was the answer. It meant everything, it was, and actually losing that appointment is devastating for us. It's, we feel like we've got to start again. We can't move forward. We're just desperate for answers. We're desperate for the medication for him. This condition can't be cured, like I said, but it can manage, and it's his life after all. That's what it means.
What has the hospital said to you about when a new appointment might be made?
Well, we were called by the consultant secretary to cancel it on Thursday, and I asked when it was likely to be, coming through, and she said that we just get booked on the system and that we will get a letter in the post. So we haven't got a date or anything. I don't know whether we're going to go, back to the end of the queue, whether we're going to be fitted in somewhere, but there must be lots of other people already with appointments which won't be cancelled. So I just don't know where we're going to fit in. And it's not just for us. I mean, there's thousands of other people like us with conditions that they need sorting out, and they're in the same position, aren't they? We're not the only ones.
That was Jane Walker talking to me an hour or so ago. Let us turn to Layla McCay, who's Director of Policy at the NHS Confederation. Good morning to you.
Hello.
And that last point is very true, isn't it? Right up and down England, there are going to be people in a similar position.
It absolutely is. In the last junior doctor strike, we saw about 175,000 appointments and operations having to be postponed. And in terms of the disruption that we're anticipating this time, we reckon it could be up to about 250,000. So that is a huge amount of impact for patients up and down the country. It's also, of course, a massive administrative challenge, as we just heard.
Have you any idea what is going to happen this week?
Well, I mean, we certainly know that with the junior doctors out for the 4 days, but those 4 days being bookmarked either side by the Easter weekend and another weekend, then the disruption is going to go on for 10, 11 days. And what we expect to see is really significantly diminished capacity within the health service with these junior doctors being out. Obviously, the big priority will be for health leaders to try to cover for that, and that has been a big focus over the last few weeks, everybody working incredibly hard to figure out the mitigations to get that cover. But at this particular time of the year, it's particularly challenging to get that cover. So
because they're on holiday?
Well, there are plenty of people who do have that pre-booked leave who are not able to take it. There are others, of course, who are not able to for other reasons. And then, of course, when it comes to locums, it is the case that some may be supporting and participating in the industrial action as well. So it is a real challenge. And that's why the other recourse is to try to reduce the amount of demand in the hospitals so that they can really focus on the most urgent and life-threatening cases and make sure that there's enough capacity there. And that is why we're hearing about these postponed appointments.
This feels like, I mean, we've been through COVID and been through all sorts of emergencies with the NHS and winter funding, etc., etc. This feels like quite a moment for hospitals.
Yeah, this has really come on the back of such challenge. I mean, ever since the pandemic, in fact, long before the pandemic, obviously the health service has had disinvestment for many years. But then we've had on top of that this difficult winter, we've had COVID, we've had flu, we've had this whole season of industrial action by various people within the health service and of course beyond. And really, it's been hard, but what we're hearing from our members who are health leaders across the whole system is that they are more concerned about this than they have been about any other strike. They think that the impact is going to be so significant that this one is likely to have impacts on patient safety, and that is a huge concern for every healthcare leader.
Layla McCay, thank you. Let's turn to Dr. Vivek Trivedi, who is the co-chair of the Junior Doctors Committee at the BMA, the Doctors Union. Good morning to you.
Good morning, thank you.
What would it take to stop this strike happening?
So we've put it back to Mr. Barclay very clearly that all we want to know is that he's serious about the pay erosion that doctors have endured. So doctors like myself have faced a more than 26% real terms pay cut over the last 15 years. And we just want to know that he's taking this seriously. At this stage, that would be a credible offer on the table. It's important to note that we've been in a formal pay dispute for more than 6 months, and we've only met with Mr. Barclay twice. And at this point, all we're asking for is a credible offer that shows us he's serious, that we can start a path of negotiations to try and address this real terms pay cut.
And is a credible offer similar to the one that other health unions have agreed? In other words, a 5% increase and one or two one-off payments as well?
So it's important to note those offers have been put to the membership, which has not yet been agreed by the membership. And actually, there does seem to be some disagreement and potentially some disapproval to those deals put forward. We've been clear with Mr. Barclay what the kind of real terms erosion has been for us. And so whilst we're happy to negotiate with him, we need to be able to do just that. But when he doesn't give us anything in response, it's difficult to move forward.
But hang on, are you saying yes or no to the idea that they come to you with a similar proposal, whether or not it's been fully agreed by the other unions, a similar kind of proposal, that ballpark, you would at least talk or not?
A 5% offer, which I think is what you're referring to, would not be agreeable to our members and not even be an agreeable starting position.
Right, so that wouldn't stop the strike. What would?
Well, I'm not going to go into the details and negotiate through yourselves in the public, but Mr. Barclay knows where we are, and we're willing to have those discussions, and hopefully we'll be able to do that at some point in the next few days if he accepts our offer to me.
What Downing Street says is that, yes, there are things that they want to talk to you about, but that the average junior doctor, the average, earns just over £55,000. This year's pay rise would take it to over £56,000. You are not on the breadline.
So it's important to note that doctors work well in excess of the average number of hours that other people do in the country. We work on contracted up to 48 hours a week, and actually a large number of junior doctors work in excess of that, which a lot of the time goes unpaid. But we've got doctors who are earning £14 an hour after 5 to 6 years of medical school, where they'll have racked up between £80,000 to £100,000 of debt. And these are doctors, people call them junior, may perceive them to just do administrative tasks, for example. But these, even in your first year, you'll be seeing and assessing patients, you'll be prescribing medications, and you'll be making difficult decisions, having difficult conversations with families. When you start on £14 an hour and treated the way you are in the NHS, it's no surprise that people are driven out. And that's what we're seeing. We're seeing doctors leaving the NHS, whether they're going to places like Australia, New Zealand or Canada, or leaving healthcare altogether, and we need to stop that.
Although at the same time, we are seeing a whole lot of. I mean, we're seeing more people wanting to become doctors than we've got room to organise the training of, haven't we? I mean, there is still a huge desire to be part of the profession, and I just wonder whether there isn't a kind of wider feeling, and particularly when you heard stories like the one we were just hearing from Jane Walker about her husband, whether there is a sort of sense that actually you are not speaking for the sort of fundamental core belief that there is among doctors, that yes, you should have all these conversations, and yes, pay should be higher, but actually there is a duty to the patient that must always come first.
I think there's a couple of things to unpick that you said there. And I was hearing the story that came on. And I want to just apologize to Jane and her husband, Dave. And I'm sorry that for anyone who has any appointments that are disrupted next week. But we've allowed ourselves to get into a position where there's more than 7 million patients on the waiting list. And I don't think it's appropriate that Dave has had to wait 6 months just to have the initial appointment. And we're failing these patients now because of an underfunded and under-resourced system. We had the Royal College of Emergency Medicine release a statement just a couple of days ago saying patient safety has long been at risk because of under-resourcing and underfunding, lack of staff, lack of beds, and ultimately staff deserve better and patients do too. And we must be making every effort to retain these competent and valuable staff. Now, that's something that's been a result of decades of under real terms pay cuts, under resourcing into the services, as I mentioned, and we need to do something to prevent that so that overall we can go back to treating patients in a high quality healthcare system, which we're unable to do at the moment.
Dr. Vivek Trivedi, thank you. Earlier, Layla McCay, and we're very grateful to Jane Walker for telling us her story this morning.
22 minutes past 8. The